majority of adults suffer from periodontal disease, either gingivitis, which is the inflammation and bleeding of the gum tissue, or periodontitis, which is the loss of tissue and bone. Worldwide, up to 90% of school children and the vast majority of adults have cavities. Regular appointments with your dental hygienist are important, but it is also critical you practice good self-care at home. Due to this video will provide you with proper techniques to prevent you from being affected by oral disease. To begin, we will discuss basic brushing using manual and power toothbrushes, along with flossing and mouth rinses. It is important to brush twice a day, once in the morning and once before bed, for 2 minutes during each brushing session. Between the two times, the evening brushing session is most important due to the decrease in salivary flow and bacteria growth during sleep. With a manual toothbrush and a pea-sized amount of toothpaste, we want to stay with the softest bristles possible to prevent tissue damage from abrasive brushing. As hygienists, we teach the Bass method, which involves angling the toothbrush at a 45-degree angle to the gingival margin, which is where the tooth meets the gums, and gently wiggle the brush back and forth, focusing on 2 teeth at a time and making sure you cover all surfaces of the teeth. To ensure all surfaces are covered, it is important to have a routine, which involves starting at the same area each time. With a power toothbrush, time and routine is the same. However, angulation is 90 degrees, which does the work for you. You just have to move from tooth to tooth. Some of these brushes can detect pressure and shut off when there is too much being applied to the surface. Likewise, some come with built-in timers and shut off after 2 minutes of brushing. Once toothbrushing is completed, it is important to brush the tongue as bacteria can collect in the creases, causing bad breath and gingivitis. This is completed by taking your toothbrush or a tongue brush and doing sweeping motions across the tongue surface, being sure to rinse in between each sweep to ensure no spreading of bacteria around the tongue surface. It is also important to floss on a daily basis to remove interdental bacteria and prevent oral disease. As hygienists, we teach the C-shape method, which involves an arm length of floss wrapped around the middle fingers for easy manipulation with thumbs and pointer fingers. The floss is placed in between the teeth and curved around the surface in a C shape to ensure no surfaces are missed. Be sure to use a fresh area of floss between each set of teeth to prevent cross-contamination in each area. If you are unsure of which age to use, ask your dental hygienist for options. Mouth rinses are not mandatory, but they act as a bactericide for the oral cavity. However, when choosing a rinse, you should avoid alcohol-based rinses, as they can dry out the tissues and decrease salivation. On the other hand, you can purchase fluoridated rinses, which will strengthen teeth and prevent cavities. Rinses are good because of their liquid form, gaining access to all surfaces of the teeth easily. However, they should not be used as a substitute for toothbrushing and flossing. We hope you found this video helpful and keep up the good oral care.